Welcome back to News 3 today at 11. It's a silent disease that affects millions of people as they age. Today's conversation focuses on osteoporosis. What is it? What are some of the risk factors? And are there any treatment options available? Dr. Carolyn Nelson is an endocrinologist at St. Joseph's Candler. She joins us now with more. Thank you so much for being here today.
Thank you so much for having me. I'm excited to be here.
I'm excited to have you answer all of these questions that I have, because I have many. Because when we think about osteoporosis, particularly women, we think to contact our primary care physician or maybe our OBGYN, but you say an endocrinologist is probably the best bet.
So I think primary care and OB are great, but there are a lot of nuances to this disease, and sometimes you do require a specialist to review the history in a very detailed manner and decide what course of treatment is best for osteoporosis. And some of the other specialties aren't as familiar with some of the more nuanced medications, and so I would recommend meeting with an endocrinologist if you have severe osteoporosis.
I mentioned this earlier in my introduction to you. It's called the silent disease because most people don't have symptoms until they are sidelined by something like a fracture.
Yes, that is very correct. And so as a medical community, we don't do a very good job of screening and treating for osteoporosis. There are 2 million fractures every year, and of those 2 million fractures, 84% of people are not tested or treated for osteoporosis. So we definitely have a long way to go. Fractures can be very devastating. They lead to increased morbidity and mortality. There are 300,000 hip fractures every year.
Wow. And
of that, 25% of people die within the first 1 year of a hip fracture. In addition, 25% end up in a nursing home and are never able to go home. And then another 50% never regain that function that they had previous to that fracture. So it's my job and our job as physicians to screen everyone and make sure that you don't have osteoporosis, or if you do, that you get the treatment that you need. And the main thing I want people to take away is that treatment is a prescription medication. It's going to be prescribed by a physician. So supplements are great, so calcium and vitamin D, of course we want to optimize those as best we can, but those are not treatments for osteoporosis. So we want you to take them, but that is not the end. You need to see your physician so that you can get the treatment that's best for you.
So 65 is the gold standard for measuring bone mineral density, as long as you don't have any risk factors. But I was reading that experts say you should think about prevention as early as in your 20s.
Yes, so I mean, calcium and vitamin D are always going to be a very good recommendation to make sure we're optimizing those. Strength training, weight-bearing exercise, those are things that are going to help prevent osteoporosis. Thinking about these things young is very, very smart. Decreasing your risk by stopping drinking alcohol, no smoking. I mean, these are all things that are going to very much decrease your risk of developing osteoporosis in the future. However, it is hereditary as well. So if you have a family member with osteoporosis, that is a risk factor for developing osteoporosis. So thinking about these things in your 20s is actually a very good idea, so that when you reach menopause, you know, you have this on your mind and they can decide, hey, are my risk factors significant enough to where I warrant a bone density before the age of 65?
Yeah. So what are some of the risk factors and what are some of the symptoms? Are there any symptoms?
So the first time people usually realize they have osteoporosis, unfortunately, is with a fracture. So, and that's another very important take-home point. A hip fracture, a spinal compression fracture, and a wrist fracture, these are all fragility fractures. These are a diagnosis of osteoporosis. I don't need a bone density scan to tell me you have osteoporosis. So if you've had any of these fractures, it's very important to bring it up to your physician and say, hey, I've had this fracture, because that means you need treatment. And so if your primary care doesn't feel comfortable with some of the medications, you're more than welcome to see a specialist like me, an endocrinologist, who will be happy to treat you. Risk factors are going to be, you know, family history, smoking history, alcohol history, not getting a lot of exercise, so leading a very sedentary life. Those things are all going to make it promote essentially osteoporosis. So, and there's really no warning signs. I mean, stress fractures can be one, like if you have a stress fracture in your leg, that could be an early sign, but really there's no warning until you fracture, and you know that is going to have devastating consequences.
Yeah, Dr. Nelson, we'll make that the last word. Thank you so much for joining us today. So much information. If you'd like more information from Dr. Nelson, you can contact her. She's at St. Joseph's Candler Physician Network Endocrinologist. That's at 4849 Paulson Street, Suite 105, 912-819-3944. Thank you once again.
Thank you.
I appreciate all the information. So valuable. Right now, we're going to take a look at our forecast. Good morning, Alyssa.